Welcome to Session 1, What Matters to You and Planning Ahead. This video covers questions that were asked by carers during our empowerment and education sessions. We hope you find this resource useful. So, what is the relationship between the advanced care planning and the respect form?
So respect is part of advanced care planning. It is a summary for emergency care and treatment that a person may want. So it's the opportunity for people to outline their priorities in either to sustain life or prioritise comfort. It's created through discussions with people, usually healthcare professionals, and the aim really is that it's more proactive than reactive. So in a situation, it's there to be used. And the DNAR, so that's do not attempt resuscitation, is also included in the respect form. Advanced care planning highlights important wishes as well, such as where a person would like to die, where they'd wish to be cared for. So it's completed while the person has capacity with a healthcare professional.
Does an advanced decision to refuse treatment need witnessing or signing off by a solicitor?
So the advanced decision to refuse treatment does need to be witnessed and signed, but not necessarily by a solicitor. It is legally binding and careful consideration needs to be given to how the statements are written. But actually, in answer to your question, it doesn't need to be witnessed or signed by a solicitor.
Do you need all the documents or just some of them? And which documents are best for us to support our loved ones?
So documents such as the lasting power of attorney, advanced care plans and advanced decision to refuse treatment needs to be done while the person still has capacity. The respect and the DNAR are also very important documents, and if you're in any doubt, it's probably best to speak to the healthcare professional that's involved in your care.
Do people need a guardianship?
Yeah, the guardianship is for people really who have lost capacity and have not been in a position before this time to appoint a lasting power of attorney.
If you do not have a will, do the government have access to what you own?
If there is no will, then your estate may not go to the people or the person that you want it to. The state can oversee the dispensation of your assets. So therefore we do encourage people to make a will.
Is there a charge for being cared for at LOROS?
No, LOROS is a charity, however the service is free at the point of contact.
Where can you find out about the levels of care or nursing homes? Who do they accept and how much do they charge?
This can be done through accessing online services such as carehome.co.uk. They have a list of care homes within Leicester, Leicestershire and Rutland. Care home selection, which is on 0800 0087 193, and they're available to help you to look at selecting a care home within Leicester, Leicestershire and Rutland. There's also social services within your area, and organisations such as Age UK and Dementia UK, they also may be able to help.
Do Care Select charge?
No, they don't.
Who goes through the respect form in detail with you? Is there a charge for them to do this?
There is no charge. It is usually completed by a healthcare professional such as a GP, specialist nurse or a hospital doctor.
Where can I find reliable services for support, such as solicitors or financial help?
You can ask organisations such as the Citizens Advice Bureau, again Age UK, Macmillan would also help in these situations, along with Dementia UK.
What is the respect form and what is it for? Who needs to see it or have a copy, and how does having one help?
It does help in an emergency situation. It outlines a person's priorities. A copy is usually kept within the medical notes, but also the person has a copy, and it's recommended that person keeps that copy with them at all times. It can be shared with healthcare professionals, including paramedics. It is not a legally binding document.
What is Advanced Decision to Refuse Treatment, or ADRT, and what is it for? Who needs to see it, have a copy of it, and how does having one help?
An advanced decision to refuse treatment is, as I said earlier, a legally binding document. It can be used once the capacity of somebody is lost. It highlights specific treatments that that person does not want to have related to their healthcare. So this will highlight specific treatments and situations. A copy is kept by the GP and it's stored in the medical notes. All healthcare professionals involved with that person's care should be informed of its contents.
So, what is Advanced Care Planning, or ACP, and what is it for? Who needs to see it, have a copy, and how does having one help?
It's a document that highlights what matters to the person, including their important wishes. Copies are shared with healthcare professionals involved with that person's care. It is not a legally binding document.